if you're having immune issues, one of the best places for you to make a change is in gut health. This is why so many people who change their diet and start eating better have a little period where something changes. Sometimes you'll have a little dip where like you change your diet and you're kind of like, man, I seem to have gotten sick a few times. You're starting to replenish and build up those immune cells and go through that transformation.
The majority of patients who have mental health disorders also happen to have gut disorders, and our gut is considered our second brain. If you're about to give a presentation and you're super nervous, some people are like, oh my gosh, I have a stomach ache, I have to go to the bathroom. Like, you can immediately tell in your gut how you're feeling. The fascinating thing about the gut is that it's linked to a lot of disorders, not only mental health, but also a lot of other disorders and chronic illnesses.
Hey everyone, Derrick Hines here. Welcome to the podcast where I'll share with you the patterns, insights, research, and technologies that we use in my own pain and performance practice to help people improve their health, speed their healing, and increase their longevity. Thanks for listening. I hope you enjoy it. Good day, my friends. Welcome to the Pain and Performance podcast. Today we are doing an in-depth dive and bonus conversation on gut health. So today my guest is going to be Patricia Schneider, and she has extensive background in kind of treating gut health and diving into all of the blood levels and doing deeper assessments than most people are used to. But we're going to do a little review of kind of what gut health is and why it's so important. In my practice, what we started finding was that a lot of our patients, you'll hear this in my conversation, a lot of our patients who were dealing with kind of slower healing processes and chronic issues were having gut health problems. And as we dug into that, we started finding that a lot of those people also had kind of stress and anxiety issues. And there's this kind of feedback mechanism between both of those. So I wanted to do an episode where we give you some answers to what's going on there. So I'm going to kind of break down some of the importance of this before my conversation with Patricia. And in there, we'll talk a little bit about some of the treatment options and how we go about getting to some of those things. But when we talk about gut health, I don't think people realize what we're talking about. Your gut is the entire GI tract. So your whole, from your mouth all the way down to the anus, basically, is your gut, or at least involved in that. So that is everything in terms of digestion, nutrient absorption, waste elimination, and everything that surrounds that, which is a lot of kind of hormone feedback, mental health. And, you know, when you study this, we're talking about trillions of cells and microorganisms collectively known as our gut biome, our gut microbiome, which is like bacteria, fungus, viruses, microbes, everything in there. So whenever we're going through the digestive process, as soon as something hits our mouth and we start chewing, saliva has a lot of enzymes in it that help to start the process of food breakdown. And so in this, we have this enzyme activity that begins before the food even moves down the digestive tract into the stomach. So it kind of comes along that, so that process gets started in the mouth and goes through all the way through, kind of follows that all the way through the small intestine, and enzymes from the pancreas and the bile aid in the breakdown of these, like, whatever you're eating, carbohydrates, proteins, fats, any of those things. If we don't have a good functioning system, and this can be dropped on any of those levels, from the mouth, from the digestive tract, from the stomach, from the small intestine, you're going to have trouble with nutrient absorption. So let's take the small intestine. The lining is covering a bunch of these tiny little hair, these little projections that stick out of your intestine. And these are little kind of villi and microvilli. So, it would almost look like the bottom of the ocean, where you have like a, kind of ecosystem where all the plants are sticking up and they have little bitty things kind of coming off of them. What this does is it creates a huge amount of surface area for the nutrient absorption to take place. So all of your vitamins, all your minerals, amino acids, fatty acids, all of this stuff these villi are vital for getting that transported into your body, into the bloodstream, and delivered to the body for energy, for growth, repair, any of those things. So that has to happen well for you to absorb things the way that you should. If you're eating right, but this isn't healthy, you're not going to absorb the nutrients really well, and you're going to have problems that present with that if those things are staying in your intestines. So this is where we have things like, SIBO, where we have bacterial overgrowth and things like that. When you look at immune function, it also relies very heavily on this. So immune function is the gut plays a very, very important role in immune function. So it's about 70% of the immune cells in your body reside in your gut. So well over half, almost 3/4 of your immune cells are in your gut. And so we call this like the gut-associated lymphoid tissue. So GALT is what it's called, and that is the immune presence in there that helps protect you from pathogens and from any food or liquids that you digest. If we're looking at that and you have immune issues and you seem to be sick often and you seem to be having problems with those things, one of the first places we want to look is your gut health, because if the gut's not healthy, your immune system is not healthy, hands down, every single time. So when we talk about improving gut health, one of the things I want people to understand is, like, if you are one of those people, you need your immune system to heal. You need your immune system to keep you safe. You need it to fight off viruses and bacteria. And so if you're having immune issues, one of the best places for you to make a change is in gut health. This is why so many people who change their diet and start eating better have a little period where something changes. Sometimes you'll have a little dip where, like, you change your diet and you're kind of like, man, I seem to have gotten sick a few times. You're starting to replenish and build up those immune cells and go through that transformation. And then you can take that into kind of a springboard where your immune system gets really, really strong and solid. So if you look at the microbiome, what we want it to be is very diverse. It should consist of trillions of microorganisms that help with a lot of functions. It's like you have a whole world in there that's going on at the same time that all of your cells are functioning. You're supporting this whole other world that helps you stay alive. They help with digesting food in the stomach, in the small intestines. They synthesize certain vitamins, vitamin K, your B vitamins, and they protect us against a lot of these pathogens. So, this balanced microbiome is very, very important for maintaining gut health, supporting your immune system. You got to have that. And for you to absorb the nutrients when we're running these blood tests that we're talking about, if the gut's not doing it, you're not going to get those things in. When we see this stuff, there's a very big kind of gut-brain connection. And if you're listening to this and you're interested in gut health, you've probably heard of the gut-brain axis. And this is like a two-directional highway of communication from your gut that's telling your brain what's going on in there, and your brain telling your gut what's about to happen and what's going on there. And you think about that, where you have this kind of feeling, I have a pit in my stomach when I'm nervous. That is your brain telling your gut something's going on. And you see people who have a lot of stress. What do they have trouble eating? They start to feel nauseous. They have all those things. So we intuitively know this connection exists, but I don't think we realize how much it plays a role in health of it. So if you look at this, the vagus nerve is one of the major communication pathways of the gut-brain axis. So it takes signals between the gut and the brain. We see this a lot in patients, and we treat this a lot in patients where it helps. If a good functioning vagus nerve helps to regulate digestion, heart rate, respiratory rate, plays this really important role in the sympathetic parasympathetic nervous system balance. Y'all have heard us talk about that, but the sympathetic nervous system is your fight or flight. I don't want to be digesting food or doing any of that stuff if that's active. So the vagus nerve, when it's working well, it kind of uses the parasympathetic nervous system to relax us, to do like kind of the rest and digest side of things. So we really do need that to have a healthy gut-brain communication. And that's very important if we're going to start to elevate this area of our lives, is can we keep that vagus nerve functional? Can we keep that thing healthy? If you look at what's happening, where is the communication? So that's almost our electrical communication, but we also have chemical communication, and that comes in the form of hormones. Most of the big ones are the ones you've heard about. Serotonin. Most of the serotonin, about 90%, is produced in the gut. So serotonin is your neurotransmitter that regulates your mood and your emotion, but it also helps to regulate digestion, which a lot of people miss that part of it. So when you have serotonin, it influences your gut motility and secretion. So are things kind of moving through there the way that they're supposed to? And also, your mood and your mental health are quite elevated when we have serotonin being released. So that is a very important part of keeping a healthy gut, is having the proper amounts of these hormones being produced and being sent around the body. Cortisol is another one that is the opposite of that. That's our stress hormone. And a lot of times we'll talk about stress triggering the release of cortisol. People have excess cortisol. This hormone can increase your gut permeability. People call that leaky gut, and inflammation. So if you have too much of that one, you're going to end up with a problem in your gut. And so you start to see all of these things are kind of really intertwined. The other part of the chemical thing is going to be your ghrelin and leptin. Ghrelin is the hunger hormone produced in the stomach, signals the brain to stimulate your appetite. And then leptin is produced by your fat cells, and it signals that you are satiated. I'm full. So we need both of these in balance. If you have too much ghrelin and you're telling your brain that I'm hungry all the time, you're going to be eating more. One of the reasons that we talk about like these prolonged fastings, like Prolon, is that it resets this system quite well. And same thing with leptin. If we're not getting that signal release, we're not going to know that we are satiated, that we're full. So those are the hormone processes that are produced in the gut and impact our brain function in a very real level. I mean, you'll feel the changes in this right away if we're getting too much cortisol, or if we don't have enough serotonin, or if I feel hungry, or if I feel full. There's a problem in that hormonal pathway that is causing it. So if you think, hey, I'm not eating, I'm not feeling like I need to eat, I'm not getting that hunger hormone, then the ghrelin and leptin pathways are not functioning the way that they should. So we have to go through and navigate that. The way you start to fix that is improving gut health. And then if you look at kind of the kind of term dysbiosis, that is basically an imbalance in your gut microbiome. A lot of times this is something that is caused by poor diet, processed foods. We'll talk about on the conversation with Patricia. You're going to see this to some degree in antibiotic use, and we need to come behind that and kind of go back through the process of improving our gut health. And a lot of times when you have this problem, when you have dysbiosis, you're going to negatively affect the production of things like serotonin, GABA, all of the mood regulating hormones. And so we can look at these things through blood testing in a lot of ways, and we want to know what's going on. We're going to talk with Patricia about what she looks at. And one of the things is kind of just starting with a complete blood count with differential. So this is looking at everything that's in your blood. So a lot of this, you will look at the levels of white blood cell counts, the differential counts. So what are the different types of white blood cells? Neutrophils, lymphocytes, monocytes, eosinophils, basophils. And we're going to go through exactly like what numbers mean what in a little bit with Patricia there. And then you look at something like a complete metabolic panel. That's going to be measuring like the substances in your blood, glucose, your electrolytes, liver, kidney function markers. Those things are really important if you're going to look at it. I like to see if somebody's having some gut issues, C-reactive protein. What's the inflammation in your body? What's going on right there? That can often tell us if the body is in a fight to improve nutrient absorption, or if we're having some inflammatory levels. So, and then the vitamin and mineral levels are really important to look at. We like to do a micronutrient test on people and see that vitamin B12 and folate, these can cause kind of poor absorption of vitamins that will end up leading to problems like SIBO, it's kind of small intestine bacterial overgrowth. Iron levels, very important. They indicate low iron levels can indicate like bleeding and malabsorption issues in the gut. So that's something that you would want to look at in the blood testing areas. And then we'll go into some of the ways of improving your gut health as well. I'd like to kind of put some of that out there. I think for a lot of people, we talk about fiber and fermented foods, and I'll give you a little hint. It might not be what you think. We've talked about that on here, so that's going to test my previous listeners. Do you remember what's going on there? So there's actions that you can take to that, and I'll let that kind of lead us into my conversation with Patricia. But hopefully that gives you a good overview of kind of what we're talking about whenever we're talking about gut health and how it can impact so many different areas of your life and your health. So with that said, I hope you enjoy the rest of this episode on gut health and take some notes on Patricia Schneider. So I hope you enjoy this, everybody. All right, Trish, Patricia Schneider, welcome to the Pain and Performance Podcast.
Thank you. Happy to be here.
Yeah, we're glad to have you. So you've had an interesting path to get to kind of what you're doing today, kind of stepping more into, some of the holistic, natural. I know there's a bunch of names around there. Some of them carry baggage, some of them don't. But take us through real quick your kind of history of getting more and more interested into this side of medicine and healthcare.
Well, thank you so much for having me. So I've, been a nurse for about 25 years, worked with all kinds of patients in all types of settings, and really delved into mental health too. So I decided to become specialized in mental health and became a psychiatric nurse practitioner. So I've been doing that for 3 years. And of course, my traditional role is to prescribe medications for an array of mental health disorders. And it really started with parents asking me if I had any alternatives to some of the medications that were the gold standards, for example, for ADHD and for mood disorders, because the medications that are traditionally prescribed do have side effects. They do have certain risks and everything. And I found like, gosh, I really don't know much about like alternative supplements, things of that nature, but I was really curious about it. That, and also my adult patients would come to me and say, I've had all of these vague health symptoms. I go to my doctor and I have blood work done and it always comes back normal. Like there's nothing wrong, but yet I continue to have these symptoms that I can't explain. So I really started looking closely at, what is it with that,
Yeah.
And once I started looking at, blood work a little bit closely and I learned how to read it in a functional way, it really opened up a lot of like opportunities to be able to provide people with additional tools in their toolbox, as opposed to like, oh, here's your medication. And I just find that in Western medicine, we just really focus on treating the symptom, and we really don't do a whole heck of a lot to be preventative. We talk about it, we talk about all the things that we should be doing, but we really don't take a deep dive into the blood work to see if there's any deficiencies there and see, try to treat them.
I was explaining this to a patient and they were like, well, I've done blood work. I said, well, what actions did you take on your blood work? And they looked at me with a crazy look, like, what are you, what do you mean? What actions did I take? Like, I was like, okay, if we're going to run a test, I call them action tests, is what we tell patients. I'm like, it should give you something that you can use in your life. You know, traditionally it's been like, let's rule out disease. Let's like run
Correct.
these things. If we find something, oh my gosh, like the whole idea is to find nothing and you get really no useful, actionable information from those things. And look, there's a place for that, right? You know, if we're looking for significant problems, but if we're trying to stay healthy or we're trying to kind of, you know, improve our health at a base level, it's like you gotta do something that gives you some action, that gives you something you can do to change your health, to change your life. So like that's, I think looking at it from that angle is like, can I take action whenever I look at the test results makes patients more aware of like what is, you know, kind of functional testing whenever we're looking at blood tests and when we're looking at, you know, different panels and stuff like that. What's your go-to on some of those? Where are you starting most often?
Yeah, I start with the good old-fashioned CBC with differential. I like the iron panel. I like the blood glucose panel as well. Thyroid, I like to look at that. And if possible, hormones, but more than just the testosterone level. And I like to just really look at that because that alone can give us a lot of information about things like underlying infections, bacterial, viral infections. What does our vitamin D level look like? What does the vitamin B look like? How is, how's the TSH? So all of that. And you're right, in traditional medicine, it's, you get the blood work, and if it falls within that range, wonderful. And if it happens to fall outside the range, really, physicians are using it to come up with a diagnosis and formulate a treatment plan that usually requires, either medication or something else. But besides that, we're not really looking at anything. And I love the functional ranges because when we look at the functional ranges, what we're looking for is we're looking to be in the optimal range. Where are we going to feel our best? And those ranges are much narrower. And you're right, nobody has ever mentioned like, hey, I've always gotten your labs look great. We'll repeat that next year, but nothing like, oh, maybe you should, if you want to bump up your vitamin D level a little bit, this is what you could do, or this is what, it's not really looked at that way. And it's like, wow, we're kind of dropping the ball with some of the things that we can be doing to improve how the body is functioning and how the cells are working like right now before
Yeah.
before it's too late.
Yeah, we started realizing pretty quickly with patients that had like certainly like complex pain problems that if you started to dig deep, there was two things that we realized really quickly that correlated on a lot of these kind of prolonged cases. Very often there was a mental health issue somewhere in there, whether that was uncontrolled stress, uncontrolled anxiety, sleep issues. There was something in that world that they checked the box on. And then many of them, whenever we started having deeper conversations and testing, we started finding that there was some gut health issues. And so you've talked a lot about how these two interrelate. We found this just through like, hey, something's wrong with these patients and they're not healing the way that they should. What do they have in common? I don't think it's a coincidence that many of them had both of those boxes being checked because of how much they relate. Kind of, if you can break that down a little bit for the listener of like what is the relationship between mental health and gut health.
Yeah, they're so connected. And in fact, the majority of patients who have mental health disorders also happen to have gut disorders. And our gut is considered our second brain, very much connected. So, and it makes sense, right? Because if you're, about to give a presentation and you're super nervous, like some people are like, oh my gosh, I have a stomach ache. I have to go to the bathroom. Like you can immediately tell in your gut how you're feeling. So it's very much connected. And the fascinating thing about the gut is that it's linked to a lot of disorders, not only mental health, but also a lot of other disorders and chronic illnesses. The gut microbiome, for example, and how the cells in the microbiome are able to absorb nutrients and remove toxins in the gut, and all of those things are impacted by things like inflammation and, a whole array of things. And what we find is that many times when people, they're coming to me with depression or their anxiety, and they also happen to have gut issues, it makes a lot of sense, because when we think about the neurotransmitters that are really responsible for our mood, and particularly like our happy mood, the serotonin, that's the majority of that's stored in the gut. And if we're having issues in our gut, it's going to affect how we're able to produce the serotonin, which, if we don't have enough of that, is, leads to depression, anxiety. And in fact, our medications, what they do is they try to increase the level or make more available for our brains to use, and therefore have a direct correlation on our mood. So our gut, many times, if we just kind of make sure that everything is working properly and we fix our gut, then we can see improved mood and other things just by the fact that we're like revamping, our gut. So it's very, very, very much interconnected. And you're right. I find a lot of the patients that have, anxiety or depression or mood disorder also have, gut issues. They're constipated, they're bloated, they can't eat certain things. Like it definitely is connected.
Yeah.
And if you fix your gut, you can fix your brain, I say.
I think they are the actions that you take for one improves the other. Yeah, like I was in kind of prep for this. I was listening to one of your interviews, and you were talking about how beneficial meditation is for gut health. And it's like it's such an interesting thing that we're doing something to improve our brain health, but when we do that, we're gonna very quickly change how our gut processes things and the health of the gut. And I think vice versa. It's like, how do we? I think that would lead to the question is, how do we know which one to spend the bulk of our energy on? Like, is it the gut health that is negatively affecting the mental health aspect, or do I have some mental health things that I need to attack and have some conversations on and go the therapy route? And does that trickle down to improve my gut?
I think with the functional approach and with people looking for different treatments other than medication, I would go with trying to fix the gut first. Because I think that's, if you fix that, that's going to, really have a positive benefit to other health systems in the body. And if you fix that alone, hopefully that'll, help with your depression. Of course, if you have mild or moderate depression, it might be a good idea to start with that, because, could it be that your gut symptoms have caused the depression because you're afraid to go out, you don't go on date nights, you're afraid to eat anything, therefore you're not making healthy food choices, and maybe is that the depression, or was the depression there first? I mean, it's hard to tell, but I would delve into the gut first, because I think that's gonna definitely improve a lot of systems, like more for your, more bang for your buck.
Let's unpack that a little bit, Trish. So somebody comes to you and they're like, look, I've had some mental health stuff. You start having a conversation. They're like, yeah, look, I have some gut issues. What's the process of this that works well, that somebody listening to this can kind of start pushing forward? So, do we start with blood panels?
Yes. So usually I will do a full assessment, and I will have people bring in their blood work, whatever they have. If they don't have it, I can usually order it, and I will order all of the things that I had mentioned before. And then I have them fill out a symptoms questionnaire and just kind of go through everything. And then we come together and I do review the blood work and what some of the numbers may mean, if there's any underlying infections that are there, what does that mean? How does that correlate to the symptoms that I'm having? So usually I do that. The symptoms that they've been presenting with, and I look at the blood work, and then we're trying to put the pieces of the puzzle together. And many times when they come with these, I've got brain fog, I'm fatigued, I can't get out of bed. It could be an array of things, but sometimes what I find are underlying like viruses too. So once we come back together and have a good discussion about what I found in the blood work and how that relates to their symptoms, and then we take the next step as far as like, what are we going to address first? Of course, we want to fix the nutritional deficiencies, the vitamin deficiencies, but is this, are the reason for your symptoms because we need to revamp your gut? And then we have this whole 90-day program that we do with patients, where the first 90 days is they're given, supplements that are going to prep the body, right? Give it what it needs. So that way in month 2, which we call the destruction phase, the body will be much better prepared for that detoxing and all that work that's going to happen in the second month of eliminating the infections and, eliminating sort of like what's causing the issues. And then in the third month is called replenish. So many times when we do, something like fixing the gut, people have told me like, wow, my pain went away. Like, so weird. Like I noticed like in the first month, I always like had, and a client told me this the other day, that she's early 50s and just was having some pain in her hands, like closing her hands, opening. She's like, gosh, I'm too young to have arthritis. Like, what is going on? And we're trying to fix her gut. And she said, it's so weird that I don't even have any more hand pain anymore. Like, and it's only been the first month. So just odd things like that. And I have so much more energy than I had before. And then it really excites them to see like, okay, like how else can I, how better can I feel in the end of, the 3 months and even beyond that. So we try to tackle multiple things all at once because the body, works together, all interconnected. So we try to supply the whole body with nutrients and then try to provide things that are anti-infective. So if there's an infection there, we're treating it. We're trying to like make sure that we're given great probiotics for the gut. And then we do provide some things like binders and things so that way they're able to like flush out any toxins that may have accumulated. So we really have a couple of great programs that can really do a whole lot.
So if somebody's looking at this, let's kind of break down what we would see on that. So if we're starting with like a CBC, which is probably the most common thing that people would have access to. I think a lot of my patients kind of come back and say what you just said, like, yeah, the doctor said it's pretty normal. What would be the kind of going through that with a fine tooth comb? What are you looking for on there? What numbers kind of make you want to dig a little bit deeper into what's going on?
Yeah, so this is why when I have patients get the CBC, I have them get the differential. And with the differential, I like to look at the lymphocytes, monocytes, eosinophils, basophils, all of that. And that's what I like to find. And what we look at is all of those together, come up to 100% if you look at it on a regular panel. And what you find is that if you have super high lymphocytes, right, then something else is low. So I look at the high numbers because if the lymphocytes and the monocytes are elevated, that reveals infection. All right. So usually we like the range to be like around 60%. And these infections are not going to like be flagged, but they're underlying, in fact, so much so that they're changing the way that the cells work. And one of the biggest things that I find too with the lymphocytes is they're a big trigger of autoimmune. So underlying viruses, again, doesn't have to be super high numbers, but again, lots of triggers of autoimmune are these underlying viral infections. So for example, if someone's like, oh, I think I might, I feel fatigued, I'm tired, I have brain fog, I went to the doctor, everything is fine. Well, if the level is high enough, like you could test positive for Epstein-Barr if the level is about 11 or 12. But if it's 8 or 9, it can still be wreaking havoc and be the cause of your chronic fatigue. But again, we're not going to do anything really in the traditional role. So sometimes when you tackle those things, you find that that's the underlying issue. Or if it's your, basophil or eosinophil, and you have eliminated so many things in your diet and you're still continuing to have symptoms, well, we could be looking at a parasitic infection.
Yeah.
So then we would go that route, try to tackle and try to eliminate those infections and see if maybe that improves, how the patient's feeling and all of that. So it does reveal a whole lot. Vitamin D is another one that I find consistently, the majority of us do have low vitamin D levels, and low vitamin D levels definitely linked to depression, definitely, affects our immune system. And traditional ranges are anywhere from like 30 to 100, which is such a huge range. And again, if you're flagged outside of that, okay, maybe they'll just say take something over the counter. But with functional, we really like the patients to be between 50 and 80, because that's where patients are going to feel their best. And I've been looking at a lot of blood work, and not only do I find patients like nowhere near the 50 or 80, but I have found some people with a level of like 12, 20. Like, of course you're exhausted and you can't get out of bed and you're depressed. I mean, just look at your vitamin D level, and it's just really like, at that point I have to prescribe, the vitamin D3, so that way, they can bump up their levels, but just things like that. And it's so interesting because I heard that, I don't know if it's the CDC, they're now recommending that we don't check vitamin D levels. I'm not sure why.
I haven't heard that.
Yeah, that's a new one. Like, why? Because when you look and you find so many people with it, so they're recommending that not be checked as often again. And the other day, I sent a patient for all the blood work, and they refused to do the vitamin D level. I'm like, why? So it's so frustrating.
I've yet to have a patient whose pain and healing rate didn't improve when they improved vitamin D levels. I have not seen that yet.
And I just don't know why that's the new recommendation or what that really came up from. But that was brought up not that long ago, that they're no longer recommending routine. And again, why? There's so many of us that, need more of it. And it's just this constant battle. It's like, why wouldn't you want to do something to keep patients healthy?
Yeah.
I guess there's no money in that. No money.
So take somebody with like SIBO. So you would see on their blood CBC with differential, you would see some of these changes, right? You would catch that pretty quickly.
Yes.
So let's go through that. I've got probably like 4 or 5 patients and followers that are gonna like hear this and be like, I've been asking him this question. So if they are, that's popping up and they're like, look, I'm dealing with some of this. Let's go through kind of how they're going to progress through those 90 days. So what's the support kind of month look like? Is that probiotics? Is that prebiotics? Like, what are they putting in their life to help with that first kind of stage of that?
All kinds of things. So we give them really supplements that are going to help support their liver to prepare for detox. We're also going to be adding supplements that help with the methylation with, vitamin B. We're also going to be giving them the probiotics, right, initially in that first month. So we really try to flood the body with all of the nutrients with supplements that they need in order to prep, sort of like get the body ready. We also in the first month, for example, have a supplement that is going to help stabilize the blood sugars. And then in month 2 is when we're adding like supplements that are going to help with drainage and with purification and with detoxing and kind of pulling out the toxins that are in the cells and then that will come out, with some binders, through the GI tract. And then with month 3, we provide supplements that are going to improve the immune system. We do add magnesium, we add the calcium, the vitamin D3. We continue to add, the probiotics. We also include some anti-infectives. So it depends on exactly what what each individual patient is really struggling with. Sometimes we may add a hormone, component to it, or we may add, some supplements that are going to support their blood sugars a little better. It just sort of like depends on, each patient. And we just kind of select the supplements based on what they're presenting with and what their biggest health concerns are. And then we come up with an individualized plan for each patient.
For a lot of people, we're like in my family, for the most part, we've got everybody on like glutathione. A lot of our families taking like tocotrienols, taking vitamin E, for a lot of the benefits that come with that. For the support stuff, I get this question a lot, is like, how do I keep good gut health? If I have the problem, let's go down the treatment pathway, identify these things. And then, kind of really dive deep into clearing out what's in there. But if I'm trying to keep my gut healthy and not have those issues, are those things that you're going to be taking, kind of in that like support phase, so to speak? And you're like, this is like lifestyle. We want you to stay functioning really well.
Yeah.
Which of those would you stay on if you're just trying to keep good gut health?
Oh gosh. So usually when patients will do one of our programs, we like to incorporate to a nutritional plan. So again, because a lot of the foods that will support our gut, we want to make sure that we're using, because food will either produce inflammation or it will reduce inflammation. So we want to make sure that we provide people really with the information as far as what nutritional choices can I make right now? And one of the biggest things really is eliminating sugar, eliminating processed foods, all of those things, which again, it's the chemicals that are added to all our foods that again are causing the inflammation, causing, the gut not to really know what to do with it. So good, clean, healthy food, drinking plenty of water. And then really, if you can incorporate adding fermented foods into your diet. Fermented foods, one of the best things that really anybody can do, kefir, sauerkraut, kimchi, all of those good fermented foods have good probiotics in them. So if you just manage to have something like that in your diet daily and, stay away from the sugar and try to stay away from the processed food, that alone is going to have a dramatic impact on how your gut is functioning.
Yeah, I'm gonna lose her name. We had at some point we had a research review on here where they studied fermented foods versus fiber in terms of like what that did for the gut microbiome, and the fermented foods were significantly better at improving diversity and inflammation and gut biome count, like everything that you could measure. The fermented foods improved more than fiber, which is like we've always said, like you want a healthy gut, eat a bunch of fiber.
Yeah.
Not to throw that out, probably better than doing a lot of the processed foods. But if we're really trying to get into that optimization world, adding in the fermented foods. One of my patients was like sauerkraut on avocado. They were like, it's delicious. Love it. Like, try that out. Put those two together and thank me. I was like, all right, we've given it a shot. Delicious. It's very, very good. So if you're trying to find ways to increase your fermented foods, do that. We love like natural pickles. Another way to kind of get some fermented foods in there. If you get real ones, make sure it's actually done. But
yeah, absolutely. Yeah.
So for you, whenever you start, somebody kind of reaches out to you, I think the trouble a lot of people have with this is like, getting this information? Is that why you're doing some of this stuff? I know you do some Zoom meetings, you do some like treatments, kind of across the country. People just don't have as much access to it in their kind of local markets.
I think so. I mean, I look at some of the people in my own life, like my mom, for example, for years. I mean, she's okay now, but she had stomach issues. She'd get nauseous, bloating, stomach was a mess. She had everything done, every test done. Everything was normal, colonoscopies and, the whole thing. And she continued to like have this nausea sometimes where she couldn't eat. She was put on, omeprazole and all of these other things. And it just, no matter what she did, it would just come on. And for years she did that. And I'm like, this is really bizarre. Like, how can my mom be this sick? Like she's not attending gatherings. She's home in bed for a weekend. Like, this is like ridiculous. So it was really like, okay, well, what is left for my mom? Because, give her Prilosec and that's great. And then like everything's fine. Well, that doesn't really leave her with really much to do. And that sort of like propelled me with, there's got to be something else that's available, because Western medicine is wonderful for acute things and they've got medicine treatments and all of that's wonderful. But when you're dealing with chronic issues, we don't really have a whole lot that we can offer people. And, one of the biggest things, I'm like, I got to figure out what's going on with my mom here. And again, once I looked at her blood work, I'm like, I saw all kinds of infections that were there and all kinds of things. And she's in the middle of a 90-day program, because I found like some people didn't really know where to go and who to turn to. So I like to like provide this information and say, hey, if you've been one of those people who have been told that everything is fine and yet you're feeling bad, just know that there are other things out there that are available that you might not know that are available. Like, I really had to look and find some things, because outside of my role, I mean, we barely even talked about nutrition in nursing school. Like, I don't even think I had a nutrition course. And many physicians also, like, were not trained to kind of talk about that and really look at, hey, this is what you could do. And it's really not our fault, but the information is out there if people are willing to sort of like do something that falls outside of, the normal box. You have to kind of go outside the box and really look for providers that will listen to you and really, take what you say into account and try to help. And I think that the alternative and the functional is just like another tool in the toolbox that I think people should, kind of seek out. Why not? If you have, if you've been through years of not feeling well and you're sort of at your wit's end, I know I had reached out, and I told a story recently that for many years in my 20s, I suffered from chronic headaches and migraines. Like, I had days that I couldn't go to work. I'd come home, go right to bed, and just constantly living this way. And it takes a real toll. And I had 2 sinus surgeries to try to fix my headaches. Then I went to an allergist, and I was seeing an allergist for 5 years because maybe that's what it is. And I still continue to just live in misery. And I said to my primary care physician, I just really don't know what else to do. Like, I don't know, like, what can I do? And he said, have you thought about a chiropractor? And I nearly fell off the table. I'm like, wow, really? Like, and I was so impressed at the time, because I'm like, here is my regular provider who's just traditional. And he said, why not? And I said, oh, that's amazing, because had he said, that's ridiculous, don't even like bother with that, I would have not, gone down that route. But I'm happy to say that I did. And I was seeing a practitioner, a chiropractor. Really, I see him now just once every few months, but it miraculously changed my headaches, like miraculously. Like, I can't believe like how much better I felt and how less I had. And thankfully somebody said, try that. If I can't help you, then here, go down this track. And I think more people should do that, because if your primary care physician, obviously that's not the scope of their practice, but if they're willing to say, hey, have you tried seeing, an acupuncturist? Have you tried chiropractor? Have you tried seeing a functional provider just for, I think they should be doing that, because
Yeah.
like I mentioned with the chronic illnesses, we don't really have a whole lot of things that we can refer patients towards.
Yeah.
But I think just letting patients know it's okay to do that is a big step.
It's one of those things that gives them hope too. It's like if you're on the diagnosis kind of hamster wheel of like, we're looking for the one thing that we can treat and fix and it's going to resolve everything. I see a lot of patients get stuck in that cycle, and it's like we're looking for it and we're trying to find it, but the whole time we're not elevating the health of the systems and the function of the systems, which is kind of where functional health is like, look, we're going to keep looking for this if we need to, but let's start elevating the health of all the systems in your body. And then a lot of times if you get to that point, we don't need to keep searching for the kind of one thing that's causing most of your problems. Your body can take care of that stuff if it's healthy, if it's not inflamed, if it's processing foods well, if everything is in the right balance inside. It's amazing how many of those things just kind of get better and our bodies resolve because we're getting healthier, we're improving that. So I think giving people that power and they kind of have the direction is like, it's such a helpful thing.
Absolutely. And if patients believe they're going to get better, and if you believe the patient's going to get better, they're going to get better, So definitely, I think that mentality, it works, there's evidence that supports that. We don't really know how or why, but if patients believe and you believe in the patients, it definitely will give them the motivation and the drive to continue to kind of root for themselves, and it's all good.
Trish, where can people kind of find, I know you do a lot of education, you do some classes and stuff and help people work through some of this information. Where can they find some of that stuff? Where can they hook up with you?
Yeah, they can go on to wholehealthalternatives.com. I usually host a live workshop once a month. If you get on my email list, I send you daily sort of tips about health. Also mental health. I do like to, kind of make sure that people are tuning in with that and self-help. So Whole Health Alternatives. If you want to check there for when my next workshop is going to be, that would be a good place to start. And my contact information is also listed there as well.
Love it. Are you on any social? Do you do any
Yep,
of
I'm
those?
on Instagram and Facebook, wholehealthalternatives.com. People can find me there. And I usually have a lot of posts about, just different tips like, eat this, not that, or, do you have this cookware in your house, or just little everyday things that I hope people find helpful.
I love it. Trish, we ask all of our guests, if somebody's listening to this and they can do one thing today to improve their health, what would that one thing be?
Oh gosh, I think just take 5 minutes of your day to focus on yourself. Self-care. We all neglect ourselves, but if you can take 5 minutes to do something that makes you happy, to just sit in quiet, just to meditate, just to have the thoughts for yourself, I think that's the best thing that we can do, because I find so many of us are doing and running from one place to another, and everybody's so busy that we neglect ourselves. So if we just take 5 minutes to do something just to check in with us, I think that that goes a long way.
There you go, my friends. Get your 5 minutes. Tag me and Trish in your post. Tell us what you did. Did you breathe? Did you walk outside? Did you get some fresh air? Do a meditation? Get some 5 minutes of self-care and let us know what you did. Awesome, Trish. Thank you so much, my dear. I appreciate everything you do. Thanks for kind of putting some positive information out into the world and helping the people that you're able to help. I know you're changing lives out there. So thank you so much.
Thanks so much.